Well, babies and small children get sick pretty easily, but sometimes what seems like a common cold can escalate into something more serious. And this week's Your Community Health, WENY's Renata Steele talks with an Arnott Health pediatrician about RSV.
And welcome to this week's edition of Your Community Health, and I am talking with Dr. Jeffrey Gardner, who we are here at Arnott Health. You are a pediatrician, and we are talking about a very serious illness that can affect many young children, and that is RSV. But first, Dr. Gardner, thank you again for coming on the segment, but we want to learn more about what RSV is and what are some of the symptoms.
Okay, well, thank you. RSV, respiratory syncytial virus, is what it means, is a virus that is very, very commonly seen in the pediatric population from anywhere from late fall into the middle of spring, usually, though you can see it all year round. In fact, it's an extraordinarily common virus, and it's unusual for a child not to have been infected with RSV at least once by 2 years of age. The vast majority of cases of RSV are relatively benign, and the child usually just has cold symptoms. The most concerning disease that RSV can cause is something called bronchiolitis. Now, this can be confused with bronchitis. Some infants and small children will develop the lower respiratory symptoms and can get quite sick. They can also develop a pneumonia with it as well. And the pneumonia sometimes can be quite serious.
Okay, and now what are some of the treatment options for a baby or a young child with RSV?
Well, unfortunately, there is no definitive treatment.
Okay.
The RSV is a viral illness, and we have very few medications that treat viruses. In most children who have the upper respiratory symptoms, you'll do the same things that you would do for a child with a cold, with a simple cold, because that's mostly what the child has. Small infant, you'll elevate the head of the crib, you might use a humidifier, you'll suck the baby's nose out very frequently to continue to clear the airway. You certainly would want to push fluids and make sure that the baby drinks. At this point would be breast milk or formula. Certainly other fluids can be used as well, such as oral rehydration solutions like Pedialyte, because dehydration is a risk in these particular babies. And the vast majority of babies get better relatively quickly and don't have a problem. There are some circumstances where babies have to be admitted to the hospital because they are having significant amount of breathing difficulty.
Okay, now if I'm a parent of a baby or a very, very small child, what can I do to, reduce the risk factors of contracting RSV?
Well, there are a few things that you can do. It's obviously a very, very contagious illness. Number one, of course, they're all common sense things. Good hand washing. Good hand washing, good hand washing, because these are the biggest disease vectors that we have. And it's important to wash your hands frequently, especially when you're in contact with someone else who is ill. Certainly, no one should handle the baby without washing their hands. Okay. The second thing is, once again, common sense, trying to keep the baby away from ill contacts, trying to keep the baby away from crowded places, because that's where babies get sick. The other thing would be that we strongly discourage any exposure to cigarette smoke. We do know that infants and young children who are exposed to cigarette smoke will and certainly can develop more respiratory complications.
Okay. Well, Dr. Gardner, thank you for educating us on RSV, and we want to thank you for joining us this week. And we're going to put more information for you on our website, WENY.com. Thanks for joining us.